Next, we shall look at the role of your non-dominant hand. So the hand in which you are holding the forceps is your dominant hand, and the other hand has a very important function during tooth extractions. You can't keep it in your pocket, so it performs a number of functions. So firstly, it helps you retract the soft tissues during tooth extraction, so you can apply your forceps, as you can see, and it also helps you support the alveolus. So when you carry out tooth movements, the alveolus doesn't fracture. And then thirdly, you will also get tactile feedback during tooth extractions. So for the maxillary anterior segment, you will keep your forefinger on the labial side and the thumb on the palate, and you can then apply your forceps, and that's for the maxillary anterior segment. And for the maxillary left posterior area, you can simply slide across, keeping your forefinger on the buccal side and the thumb on the palate, and you simply slide across, and then you can apply your forceps as you need to carry out the tooth extraction. Okay, so forefinger on the buccal side, thumb on the palate, just like the maxillary anterior region. For the maxillary right posterior region, you will have to bring your forefinger on the palate and the thumb on the buccal side. Okay, that's the position you will need to adopt for the maxillary right posterior area, and make sure the other fingers are closed, otherwise they will rest on the patient's face like a spider, which obviously they're not going to like. So that's the position of the non-dominant hand on the maxillary for the maxillary teeth. So this is the position for the maxillary right posterior quadrant. Forefinger on the palate, thumb on the buccal side. Now for the mandibular teeth, you will have your middle finger on the lingual side, forefinger on the buccal side, and your thumb supporting the mandible directly underneath the tooth extraction, wherever you are carrying out the tooth extraction. So this is very important because mandible is a mobile bone. It's not fixed to the cranial base like the maxilla. So you must support the base of the mandible with your thumb. For the mandibular left quadrant, simply slide across, and you will have your middle finger on the lingual side, forefinger on the buccal, and your thumb supporting the mandible. I'll just lift it so you can see. Thumb supporting the mandible. Okay. Now, if you are a right-handed operator, as we discussed in the position of the extractions for the mandibular right posterior teeth, you will stand behind the patient, your forefinger on the buccal side, thumb on the lingual side, and these three fingers supporting the mandible. That's how it will work. Thumb on the lingual, forefinger on the buccal, and the remaining three fingers supporting the mandible, as you can see. Can you see my fingers moving? They're supporting the mandible. So that's the position of the non-dominant hand for the mandibular right posterior quadrant. And as I explained in the position of the operator and the patient, if you are a left-handed operator, for the mandibular left posterior quadrant, you will have the forefinger on the buccal, thumb on the lingual side, and the three fingers. Here you can see the three fingers supporting the mandible at the base. That's for the left-handed operator. Okay.